This is part 2 of what is involved in the stages of a colonic at 360 Health here in Cairns. We're not looking particularly sunny today, but we are looking tropical. We do have a window in our treatment room. So the first video you saw the machine and what happens to get set up, and we'll just use layman's terms for the sake of humor and ease once you are plugged in. The next part of it means that we get to see what happens here at the table. The patient, the person who is here for the treatment, is on the table. They are gowned up, which is this glorious blue thing here, with the Velcro at the back, just like a hospital gown. And to set up, they are on their side. So if there's no clothes, gown goes on, everything's covered. They're on their side with their left shoulder below the pillow, their body facing the wall, knees at about 45 degrees on their side, and the sarong draped across their lower half. So everything's covered up. Now the kit, single-use colonic irrigation kit, is used as described in the first video to conduct and facilitate the treatment. Once you are plugged in, you will then roll onto your back, keeping your knees at 45 degrees, gown still there, sarong still covered up. So everything is very private. The only real area that we need during the treatment is your torso. We'll be doing some breath work and some massage work during the treatment to help facilitate and conduct the colonic effectively. So as you can see here on the massage table, we call it a treatment table. It does connect quite closely to the machine. So if you can use your imagination, this kit connects you, that is about here, to the machine once it's all unraveled. So the water, being for the first time for some of you who haven't had treatments with us before, will feel slightly different. The fact that you have something lodged in your rectal cavity also is a bit of a headspace. So we do our best to try and help people breathe through the neuromuscular sensitivity of having a colonic. Once the brain feels safe and the gut's okay with what's going on, generally speaking, the colonic is quite successful. The speculum itself is only about the width of a 10-cent coin. Now, I know that sounds big when you're thinking about it, but technically upon application, the standard healthy bowel movement is bigger than a 10-cent coin. So the 3 bands of muscle around the sphincter actually do a pretty sterling job of facilitating the treatment if we can connect with you to manage those neuromuscular signals that happen during the treatment. Gas, water, fecal content, and whatever else may come out during the treatment is facilitated by you being connected to that plumbing supply. So it technically is a closed system. We can't take any samples or anything home with you. Sorry about that. So when you think about it, if we let the water run, just without anything else happening apart from chatting through your health history, talking through some of your goals, breathing and relaxing, listening to some cool tunes in the background, the body eventually gets to a place where it is okay with what's happening, and that's where things start to get exciting. Stay tuned for part 3 of what happens in a colonic.